Okay. Now, as you know, we celebrate every May 15, the National Hispanic Hepatitis Awareness Day. And we invite you, for those who are in New York City, please join us in the event. It's going to happen on the steps of the City Hall on May 15, 11 in the morning. Together with other organizations of New York City, we join efforts to create awareness about hepatitis in general, affecting all our communities. Today, our first webinar is going to be about viral hepatitis, just the basics, to remind everybody how these three different viruses, A, B, and C, affect our body, how we treat it, and how we can prevent these conditions. For this, we have our friend, Paul Porter. Paul is originally from Boston and has over 25 years of experience with HIV and hepatitis C and substance abuse. Paul has been published in several publications addressing harm reduction and viral hepatitis, and he's dedicated to educating everyone on the facts of viral hepatitis, disease prevention, and access to care. Recently, Paul was awarded the Commissioner Service Recognition Award from the New York State Department of Health. Currently, Paul is the Community Outreach and Education Manager at the American Liver Foundation, Greater New York Division. So, Paul, you go ahead now.
Thank you, Luis, and thank you, everybody, for participating in today's webinar. Feel free to type in your questions if you have any in the question box, and as we get through them, I will try to answer them as quickly as possible. If not during the presentation, then definitely at the end. And also, if there's any technical issues, if you can't hear us well enough, or if you can just type that in as well. And also, we're doing something a little different. We want to do a little poll that if you could just type in the state that you are listening from, that'll help us with looking at how much our outreach has worked to reach everybody. And we see some folks from New York City have already chimed in. Thank you. So in California, Illinois, I love it. Thank you so much for that. That's really good. Keep it going. It's really helpful.
Oh, great.
So South Carolina,
Michigan, California.
Okay.
Louisiana.
So this is a great roll call. It's really important that we get the message out to folks that maybe aren't in metropolitan areas. And it's really great to hear from folks from Puerto Rico as well, in Flint, Michigan. So today we're going to talk about, the basics of viral hepatitis. So we're going to talk a little bit about hepatitis A, B, and C. We may spend a little bit more time on B and C because those are the two viruses that are pretty prevalent in all of our communities. And we want to share any updated information on the two, and especially remind people that there is a cure for Hep C. So when we talk about hepatitis, we're talking about the liver. And, we only have one liver. It's the only organ in our body that can be rejuvenated, that can rejuvenate itself. And it does a lot of different things, but a lot of people don't know where their liver is located. So we're going to share that. So your liver is located on your right-hand side, and we're just going to get the mouse to work. And there it is. So your liver weighs about 3.5 pounds. It's about the size of a football, but it's thin. It's not big in girth like a football. It's kind of like 3/4 of an inch thick. It kind of feels like a chicken cutlet, so to speak. It has that consistency that if you squeeze it, it comes back to its shelf. It's normal size. It does not look like what we see in the grocery store, so please do not compare a cow's liver to our liver. It sits on a little bit of an angle, and as you can see, it's partially protected by our rib cage, and it is a little exposed. And so what happens is that as it's our body's power plant, it does all these different functions. So the liver will break down food that we're eating so that we get the proper nutrients sent to the right places. It filters out the toxins and the bad stuff from the food we eat as well. And it helps us with bile. There's good bile and bad bile. The good bile helps with the digestion. And if there's any excess bile, hopefully the liver can process it and get rid of it. But if not, then we might have to take some other measures like maybe diet, exercise, or whatever it is. And no matter how we get anything into our body, whether we're drinking it, eating it, whether we absorb it into our skin, if it's in the air, it all gets processed through our liver. So it's a very important organ. It helps filter blood where the heart pumps blood, the liver filters it. So they work together even though they're not necessarily physically connected. But it's all part of this engine that we have that keeps us going. And with a good, healthy engine, you know, we have a longer, healthier life. So if our liver is able to continue to filter out toxins, kill germs, stops cuts from bleedings, you know, that gives us, you know, a longer life, and, you know, we have an easier time of fighting off infections. It also helps detoxify substances that are harmful. And there could be a lot of different things. It's not necessarily the pollution, but also like things at home, cigarette smoke, secondhand smoke, thirdhand smoke. Smoking is really bad for your liver. We see a lot of commercials how it reminds us how it affects our heart and our lungs, but cigarette smoking is just as deadly and just as damaging on our liver, whether we're secondhand or directly smoking. Also, different types of chemicals. If we're in an environment where there's a lot of pollution, yeah, we're breathing that in. It could affect our lungs and our sinuses, but also, you know, it might affect other organs. So if there are chemicals that we're breathing in or we're getting into our stomach and into our system, the liver can help detoxify that. Especially food, you know, there's a lot of harmful stuff in foods that we eat, over-the-counter medicines, vitamins. If we're taking too many vitamins for the wrong reasons, alcohol, you know, there are things in alcohol that our body can detoxify from, but then, you know, sometimes it can become a little bit challenging, especially with the excess amount of these things that we put into our system. So as you see in the diagram, the liver is partially exposed. And if you have ever gotten a physical exam and the doctor asks, or the nurse asks you to lay on your back and they press on your stomach and they do some tapping, what they're doing is to see if there's any inflammation. So we can't do it if we're sitting up pressing our liver, but if the patient is laying on their back and their body is all relaxed, they can knead, like as if they're kneading dough, and they tap, and there's a sound that they look for. And also, you know, they can feel if it's inflamed. We won't feel it because we don't have any nerve endings in our liver. So we can't feel the pain from the liver, but the physician or whoever is examining us can feel the inflammation. So that's how they can determine if the liver has been a little bit more inflamed. And underneath it, you see the gallbladder. And the gallbladder, you know, you can live without it. It just helps with bile. But what happens if some folks have gallstones, the stones can move. And if you have a gallstone attack, the stones can move into your liver, into your bile ducts, and cause some serious damage. So, you know, most people, if they have gallstones, they're left alone. But once they start to move around, then they're removed so that it doesn't damage the liver. So what is viral hepatitis? Hepatitis, is like a lot of us know, is inflammation of the liver. So it's usually caused by viruses, and there are many types. In this country, there's a lot of information about hepatitis A, B, and C, but hepatitis D is peeking its head a little bit, and more information will come out soon about that. Hepatitis A, B, and C are the most common types in this country. Not everybody is at risk for hepatitis A, B, or C. Not everybody gets all three. Some people may. If you get hepatitis A, it doesn't necessarily mean that it will produce or lead into another one, but if you're at risk for one, testing and screening is always important. So liver diseases are caused by many different things. Viruses, genetics could be mother to child, autoimmune disease, excessive alcohol use, poor diet, obesity. Fatty liver is a really big thing going on in many of our communities now, especially in some with school lunches that aren't very healthy for kids. So kids are at a higher risk for childhood obesity, people with high cholesterol. So there's a lot of things around fatty liver. Reactions to medicines, street drugs, or toxic chemicals. You know, people take medications maybe a little too much, or maybe they don't take them as prescribed, and that can cause some damage on the liver, because if the liver is not able to filter them and process them, then they're not going to be as effective. Same thing when the liver is trying to help build muscles. If the liver is filtering toxins and the liver is able to detox various chemicals that are harmful, then the body as a whole has a chance to work better and stronger, so that there is more muscle formation and less waste. And a lot of other factors come in, and the liver plays an important role in all of that. So getting to know the ABCs of hepatitis is a good way to start. Hepatitis A, is spread through food or water that's been contaminated by fecal matter. A lot of times if we go into restaurants, you go into the restroom and it says all employees must wash their hands before returning to work. Well, this is one of those reasons. It could be, if someone uses the restroom and they don't wash their hands and they go back to handling food, if there's been any fecal matter, bacteria that's been in contact, then it could be spread onto the food. It's usually like if somebody's like making a salad with their hands, if the people are actually physically handling the food in the preparation, that's where the contamination could happen. Not so much on the grill. It's usually with, say, if we're putting the accoutrements on the plate, the tomato, the lettuce, if we're decorating the plate with the sides and all that little stuff, that's where it can come in. So it's not like from the person cooking, it's from the person handling the food physically. Hepatitis A hits you kind of hard and kind of fast. It usually lasts around 3 to 6 weeks. There's a lot of fatigue, a lot of jaundice, which will show you an image of what jaundice looks like. It's a lot of diarrhea. The urine can be the color of iced tea, can be really, really dark. And the fatigue is interesting because people will rest, but when they wake up, they're still tired. It's not a restful type of nap or piece that they have. So it causes like a lot of, it feels like anemia for a lot of people. But there is a vaccine. If you've been exposed to the virus, the vaccine isn't going to do anything for you. But, if you don't know and you've been vaccinated afterwards, it's not going to hurt you as well. Hepatitis B is pretty popular in the world of STDs today. It's contaminated through blood and body fluids, semen, vaginal fluid, and saliva. So if you look at what's happening if you look at STDs and you look at syphilis, gonorrhea, and you see how people are getting those oral sex, vaginal sex, things like that, a lot of fluids are involved. So, there's an opportunity for a lot of viruses to live within these fluids and spread very easily. You don't necessarily see it or smell it, but it can still be there. And 5 to 10% of the adults that are in contact with Hep B do develop a chronic infection. Acute is usually like the onset, and chronic is ongoing. So if I start coughing today and my cough lasts through Saturday, then I've developed a chronic cough. So something that is ongoing. So liver disease, because our liver has no nerves, we don't feel it. So we could develop a chronic infection before we become symptomatic, which is the jaundice, the fatigue, and the other issues. Again, there's a vaccine for hepatitis B, but a lot of people of a certain age that are maybe in their 50s and older have not been vaccinated as children because the vaccinations for A and B weren't developed until much later. So there's a whole generation of us that missed out on the vaccines at childbirth or before school, and maybe didn't realize we needed them until we were entering college at an older age, beyond 25 or 30. So hepatitis C, it's really important to remember that it's blood to blood. So it has to be 2 pools of blood that come together. So if somebody is getting a blood transfusion and if the equipment has not been cleaned or sterilized, or if it's not new equipment and there's any residual blood, it could happen that way through dialysis, injection drug use, if the people that are using are sharing needles and the equipment. Just because you inject drugs does not mean you're going to get hepatitis C, but if you are using contaminated equipment or equipment shared by somebody who we don't know their status, then the risk is increased. Tattooing, if the tattoos are substandard, a lot of tattoo artists, maybe not be paying close attention to the equipment they use, or maybe we're getting tattoos in unconventional settings, prison, someone's house, basement, or whatever, and some things may be shared, like the ink or even the tattoo needle. And the thing about Hep C is that people can have this for many, many years before they realize that they have a chronic infection. The majority of the people, up to 85%, that come in contact or have been exposed to Hep C will develop. And if it does become chronic, sometimes people don't know until they have advanced liver disease, or if they could be, on the cusp of getting a cirrhosis diagnosis. Question came in about which street drugs. Street drugs as a whole, if you just think of the name, street drugs, they're not made in a scientific setting. So, like crystal meth, cocaine, heroin, drugs that are injectable, there's usually very, very little drug and a whole lot of extra stuff. So the drugs have a lot of chemicals, a lot of toxins, and however we get them into our system, it's the stuff that causes the damage. So if I'm injecting cocaine hypothetically, and maybe I don't really know the source of where it's coming from, I could be injecting a lot of other chemicals that could be really damaging, that can cause kidney failure, damage to my liver, a lot of different stuff. So, it's the same thing with over-the-counter medicine that can cause, damage to the liver. If too much of anything, is never a good thing. So as a whole, it's really important to know that excess is what can cause a lot of damage. And then, of course, what is the chemical? What is it all made of? And most illegal drugs or drugs on the street are not homeopathic, they're not natural, they're filled with chemicals that can blow up a city block. So if you figure, if a crystal meth lab is discovered, they block off, how many miles around this one little place. So if that little lab can do that much damage, imagine what the drug that comes out of that can do to our bodies. So it's pretty significant. And yes, hepatitis A and B can go unnoticed for quite a long time, because if the person is not showing any symptoms, they're not going to know that there's anything wrong. And the liver has no nerves, so it's a silent organ, so it doesn't emanate pain. So if we're not feeling pain in an area, we're not going to pay any attention. We might just think, oh, maybe it's because I'm older, maybe because I'm a little heavier, maybe because I smoke cigarettes. People sometimes, if they feel their bodies aren't as strong as they'd like them to be, they might find a reason. Oh, I'm in my 60s, maybe I'm supposed to go slow, or maybe this or that. So sometimes they don't realize, because they haven't had it addressed, that it could be something else. So it could just go on. And that happens with a lot of different things. People think they have a little cold and it can develop into pneumonia. So, people sometimes don't listen to their bodies, and they may just write things off. So I always tell people, never use your age, weight, or any of your behaviors necessarily as an excuse on why you don't feel good. Bring it up to the doctor or to your nurse or your healthcare provider and say, for so long I've noticed this about how I feel. Or, I don't know if there's anything wrong with me. Can I get a test to see, how I'm doing? A lot of people, are very health savvy these days. They're very health conscious, because fitness and body image is such a big thing that, they're into finding out, but not everybody is, and that's okay too. So if you don't know if this is how you're supposed to feel, can't hurt to ask. So we're going to talk a little bit about hepatitis B before we get into Hep C. Hepatitis B is contagious liver disease that results, again, from the infection of the B virus. Like I mentioned earlier, acute Hep B refers to like the first 6 months you've been exposed. Some people can fight off the exposure within that time because of the amount of virus they've been exposed to. So if you've been exposed to somebody that had the virus, but they weren't very infectious, like a very low or undetectable viral load, your body's going to fight it off because your body's pretty strong. But if the person has maybe, or the source is a little higher in viral content, then it's definitely going to be, a positive exposure, and it could develop a chronic, and over time it'll build in the body. And then if the person doesn't know they have it, again, it can cause health problems. So acute and chronic are the two words. Chronic is used a lot. A lot of people don't even have the discussion about having an acute illness. It goes pretty much right to chronic. So people ask about, how do I get Hep B sexually? And, it's like I said, it's spread through blood, semen, or other bodily fluids. So if somebody, many years ago, mono used to be something that a lot of people got, and they used to call it the kissing disease. So if you were like kissing a lot of different people and there was a lot of saliva, it was based on that. So, that's like a strain of liver disease. But, hepatitis B is much more damaging. It's much more easier to catch without realizing it, because the amount of it that lives in the saliva. Saliva kills a lot of things, but it doesn't kill everything. So sometimes if you're somebody that maybe has just different experiences, you may be more at risk. So it's not a penalty, it's not a punishment, it's just what happens, and it doesn't happen to everybody, but it's very common. And the numbers are changing. Right now, the numbers are reporting around over 40,000 new infections occur every year in the United States. But, if you look at your local data, you can go to your local health department and find out what the rates are like in your area. And you might see that hepatitis B is more prevalent in this community over that community. It could be Eastern European, Asian, immigrant. It could be, young people. So you can see how the health department breaks down the information. And also, a lot of people aren't aware that there's a vaccine. So if somebody is new to the United States or new to a country not of their origin, they may not know there's vaccines available. So, nobody might say, hey, now that you're here, let's get your health together. They might not have the information. So they may have the disease and not know they have it because it hasn't been brought up. As cultural stereotypes, have a big role in that too. Some things people don't want to talk about outside of the family, outside of the house, outside of the community. So things don't often get, discussed or shared. So sometimes we always hope the young folks can bring the information home to their parents, grandparents, different generations that have been left out of this, and hopefully get the health and care that they need. So now, what's been really exciting in 2018 is the new 2-dose Hep B vaccine, which the ACIP has supported. So the ACIP is the Advisory Committee on Immunization Practices. And in 2018, they unanimously recommended the Hepatitis B vaccine for individuals 18 years or older to prevent the infection. Hep B Foundation, which is another national organization that we work closely with here in New York as well, welcomes the use of the new vaccine because, it really reaches a population that sometimes, like I said, might fall through the cracks. It could be, and especially, school-age children, when you have a child and child's getting ready to go to school, they're vaccinated in the hospital usually before they go home. But what about the parents? So now the parents and everybody else that have missed out are now able to also get this vaccine, and instead of worrying about the 3 doses over 6 months, and now it's just the first dose, the vaccine, and it's just cut down. So the 2 doses is a lot easier to manage because some people fall out of care, or we might lose them for some reason or another, so they may not follow through with the rest of the vaccines. It's easier to give somebody 2 vaccines than it is to give them 3. So this is exciting, it's new, and we want everybody to know about it. You can Google it, you can go to the World Health Organization, just look for this information in your area and talk about it amongst your coworkers, and just figure out how do we help all of our patients, all the people we serve, be aware that vaccines are easier to obtain now, and they're a lot safer and more effective than they have been in the past. So, the data that supports a lot of the importance around this is that, more than 257 million people worldwide and up to 2.2 million in this country alone are chronically infected, which can lead to cirrhosis, liver cancer of up to over 25% of those folks. Liver cancer is quickly reaching, high proportion of amongst the death of people with undiagnosed liver disease. So it's really important that people get tested. especially amongst different health disparities affecting Asian American, Pacific Islander, and African communities, in addition to infections across the country, rising along with folks that are increasing the use of opioids and injection drug use. The Hepatitis B Foundation is a leading nonprofit dedicated to finding a cure for Hep B and improving the quality of life for those worldwide through research, education, and patient advocacy. So everybody please support the Hepatitis B Foundation. It's just as important, whether it's hepatitis A, B, or C. The disease is non-discriminatory, it's everybody's disease, and there isn't one that's more important than the other. So living with liver disease, we were like, well, if my liver doesn't have any nerves, how do I know anything's happening to it? It doesn't feel anything. So let's take a look at what our liver looks like. So in the upper left-hand corner, here's a nice, pretty picture of a healthy liver. It's pinkish, it's smooth. So the coloring indicates that it has good blood flow. So, just like our skin, if our skin is nice and shiny and healthy, you can tell we have good circulation, we're pretty healthy. So here it's in our liver that is filtering the blood. It acts as like this sponge. So if you were to touch the liver, which we can't, but if you could, blood would come out because it filters the blood. So if this healthy liver was, say, my liver, and my lab said, Paul, your liver results were unremarkable, that one word, unremarkable, means that my liver probably looks like this. It's working well, it's functioning, there's no bumps, there's no ulcers, it just seems to be in pretty decent shape. And it's got a normal, shape to it, and there's the left and the right, you can see everything looks good. But then maybe over time, I may develop high cholesterol, high triglycerides, maybe I don't know, maybe my diet isn't the greatest, maybe I gained a little extra weight, and the cholesterol and all these other things are indicating that something's going on. That might mean I could be starting to develop fibrosis or fatty liver disease. So this image in the middle, before we look at the inside, if you notice the outer circle of this liver, it's not as pink as the one in the upper left. So that's one indication that something's not working right. So the color is changing. It's not as pink and bright and consistent. It's a little faded and a little lighter. But also what they did is they shaved a piece off so we can see the interior of the liver. And if you look at all the white that you see in there, that's the fibrosis and the scarring. And what's happening is the liver ducts, the bile ducts, are starting to get closed up by the scarring and the fibrosis. So what's happening is the blood isn't filtering as freely through the liver as it once was 6 months before, 3 months before. So what happens is that if I have high cholesterol, all those things that I talked about, I could be developing some fibrosis because maybe my medications aren't working as well as they did. Maybe it looks like I'm not compliant with certain medicine because, as my labs will show, oh, the issue that I'm treating is still there, or there's not enough medication in my system. It could be because the liver is not filtering the medication, it's not absorbing the medication the way it was. So what happens when we get to this middle stage? Well, if this is a diagnosis of NAFLD, non-alcohol fatty liver disease, or if it's just the fibrosis, either fibrosis 1, 2, 3, or 4, also known as your F score, it's going to determine what we should do. So if this is fibrosis 1 and I'm starting to develop fatty liver, before I get any medicine, my provider team might suggest I try to lose a little bit of weight. Don't go on a diet. Diets are kind of like a setup for some people, but maybe if I just try to cut down on some of the unhealthy things that I'm eating, and maybe just make sure I'm drinking a lot more fluids, eating a lot of low-fat foods, and maybe getting some exercise. I don't have to join a gym, it's too expensive. Maybe if I just walk to work or go for a walk after lunch, anything to get my heart rate up. And if I can lose a little bit of the weight that I've gained that's got me here, I go right back to a healthy liver. So this is where the liver rejuvenates itself. So I can start off in the upper left, end up in the middle, and then once I'm diagnosed, if I pay attention to what's going on and I get this diagnosis, I can always take measures to get my liver back to a healthy state. So another question came in is like, at what stage will the liver not bounce back? As you see in the last picture of extremely scarred liver with cirrhosis, at this stage, it's really, fair to say that there isn't any bouncing back from this. But what is happening now is that people that have cirrhosis, if they're starting to show signs of cirrhosis, and if it's found quick enough where like, okay, you're almost there, it could be slowed down and reversed. But once it gets to a certain degree, and with labs and testing, then there's really, other issues that have to happen. But it's case by case. And if you have a really active, good, honest relationship with your provider working around this, you can find ways to prevent yourself from getting to a point of no return. Unfortunately, this picture of cirrhosis is, probably end of life, or this person may need a transplant in order to stay alive. If you look at the way the liver is breaking apart, if you go back to the first picture, then you look here, you see where it's splitting, and it's just basically dry. There's no blood being able to be filtered through there. No medication is really doing anything for this. And you can see all the bumps, which are also called nodules. So those are could be like cancers, they could be tumors, there could be a lot of different things that are creating the liver to just crumble apart. It's almost like if you have an old sponge or a t-shirt and it just deteriorates. This is what's happening. So this is advanced stage cancer, cirrhosis, with possibly the beginnings of liver cancer. So this patient hopefully would be able to get on a list to get a liver transplant. But at this point, I'm not sure even a partial transplant would work, because there's so much of the rest of the liver that is unhealthy that a partial wouldn't have enough space or enough chance to rejuvenate the whole liver. If it was half of this, chances are a person can get a partial transplant, and then that can help the whole liver rejuvenate as a healthy liver again. But at this stage of the game, I don't think that that's possible. But if we're in the middle, we can always bounce back to the first picture. It's the only organ that can rejuvenate itself, and that's why we have to take care of it and be so mindful. So jaundice is a symptom of hepatitis that we can visibly see, where our liver isn't maybe emanating any pain, but if someone was to look at us, a provider or someone we know, we might be able to see the yellowing. Now, these are two different individuals with different skin tones. So the one on the left is a Caucasian male, and you can start to see the beginning of the yellowing in the corner of his eye. And the picture on the right is of someone of Asian descent, so the skin tone's a little different, and the yellowing is a little bit more prominent, also because not only the person's pigment highlighting the color, but also because probably the amount of a chronic infection this person has, the more jaundice is going to be available. If the person was darker skin, darker pigment, sometimes it's more obvious because the whites of the eyes can be really bright, and then all of a sudden, if it starts to get yellow, the pigment around the eye just makes it look even worse. So this is obviously a chronic stage. When you have jaundice, this is a physical symptom, one that you can't necessarily see if you look in the mirror. So if you're looking in the mirror now to see if your eyes are jaundiced, chances are you won't be able to tell, especially given the fluorescent lighting or wherever you are. It's usually something that another person can notice within you. So don't try to diagnose yourself with jaundice. Many people try. So cirrhosis, we just talked about that a little bit, but cirrhosis of the liver occurs between 10 to 30 years. So if you were diagnosed with hepatitis C or another fatty liver, hepatitis B today, it doesn't mean you're going to develop cirrhosis at all. What happens is that if you diagnosed with one of these viruses, chances are you've had it for a couple of years, a few years, or many years, and you're diagnosed with liver disease, but then the further testing that's done will determine if you have cirrhosis. So not everybody that gets diagnosed with liver disease is also diagnosed with cirrhosis. Cirrhosis is an advanced stage of the liver disease. And if you look at these diagrams, you know, the first one, you look inside the liver and you can see those vessels and portals that I mentioned that are flowing blood. And then if you look at the picture on the right, you can't see them because of the cirrhosis. The cirrhotic is taking over the vessels, so there's no absorption, there's no blood filtering. So this is another image of what cirrhosis looks like in the liver. This picture of cirrhosis is alcohol related. So if you notice the shape of this picture compared to the shape of the other picture of cirrhosis, there's a gross difference. But if you notice, they both have these bumps and nodules. So what happens is the liver gets inflamed, right? Inflammation of the liver, that's what hepatitis means. So it's inflamed, but it also shrinks. So it's kind of like does a couple of different things where one side is really inflamed and then the other part is dry. So this is like a really like a rough piece of like, say, an overcooked piece of cube steak. You know, no matter how much gravy or how you try to cut it, it just doesn't budge. It's just non-penetrable. So the medicine and blood is just not filtering through this. So this, again, you know, there's no reversal at this stage. This, again, could lead the person to transplantation, or unfortunately, it could take their life. And also, another physical symptom of cirrhosis and advanced liver disease, along with the jaundice, is the swelling of the stomach. So what happens is that when a liver gets cirrhotic, like this, it can develop fluid called ascites, A-S-C-I-T-E-S. Depending on where you come from is how you pronounce it. And what that does, it creates this fluid buildup in your stomach. So that's where the stomach will extend, and it looks like the person could be pregnant because it's perfectly round centered. It's not like if I was heavy, you know, you could see it on the sides of my stomach. The fluids are concentrated to the front of the abdomen. And what happens is the pressure from those fluids presses up against our other organs, and that can cause discomfort. So your liver doesn't feel anything, but the fluids, because our stomachs can only stretch so far, it presses up against our other organs, which can cause pain and discomfort. And that usually can be drained. And it's not as simple as just like poking a hole, it's a process. You know, and it could be quarts of fluid that come out. It might be done every week, every 2 weeks. It really depends on where in care the patient is with that. Unfortunately, some people never get care until they're beyond that stage, and then the bacteria and the virus is taken over, and it could lead to cancer, and the cancer could spread throughout their body. So this is not the best place to be. So switching into Hep C. Hep C is also a liver disease caused by a virus. Like I said earlier, it's blood to blood. It has to be 2 pools of blood. It can cause cirrhosis, which is the scarring, liver cancer, and or failure. Also, no symptoms for many years before you're diagnosed. If somebody was injecting drugs in the 60s and they stopped in the 1980s, they were diagnosed with Hep C, and maybe that was their only risk factor, well, that could be it. But it doesn't really matter how a person gets it. What matters is they get the diagnosis and they start care. So I don't spend a lot of time on, oh, hi, how did I get this virus? We know how people get it, and how it applies to the individual doesn't always matter so much. What matters is now that we know, what can we do to get rid of it? So that should be just a little something extra to think about. And as these numbers show, over 3.5 million people in the US are infected. Then there are the folks that don't even know they have it because they haven't been screened. And it could be for a number of reasons why they haven't been screened. So people ask, you know, should I get tested? And the answer is yes. If you've ever used needles or other equipment to inject drugs, even one time, if you're experimenting with injection drug use and, you know, you have your own gear, your own instruments, but maybe you need water and you want to use your friend's water and that's all you're using, well, even that water can be contaminated enough that could give you the virus. You're not going to get diagnosed in 30 days from exposure, but you know, it might come out later. So just be mindful that the incubation period is much longer than, typical infections. Baby boomers, were the big, population that was targeted for many years around screening and stuff, especially veterans that fought during the Korean War. But as we see with the opioid epidemics around the country, a lot more people of the ages of 19 to 29 are now being diagnosed because of sharing needles and being at higher risk. So the baby boomers have had to share the spotlight as far as making up the new numbers for Hep C. And so it reaches a lot more people now. If I'm HIV positive and I was exposed to HIV from blood contact, then that puts me also at risk for hepatitis C. Hepatitis C is 10 to 15 times more infectious than HIV. It's more infectious than HIV. More people die from Hep C than they do HIV. So if you're at risk for one, you're at risk for the other. If you're a healthcare worker or emergency medical person that's been exposed to a needle stick, please get tested, because you may think that, oh, the patient moved while I was trying to draw blood, it was an accident. Yes, but you don't know what the patient could be dealing with or where the exposure could come from. So you want to make sure that if you've had an occupational needle stick or anything like that, to definitely get checked out, get screened. Blood-to-blood products, organ transplants before 1992. If you have abnormal liver enzymes, that might be common for some people of a certain age, but it doesn't necessarily mean you should ignore it. If you have abnormal liver enzymes, you should get screened. It could just be your chemistry, but let's just make sure that that's all it is. Hemodialysis, again, a blood filtration system. And if you were born to a hepatitis C infected mother, now the important thing to remember of this is that it's only a 5% chance that the mother could give Hep C to her child. 5%, less than 5%. So a lot of factors in this is like, how infectious is the mom? How high is her viral load? Does she have a high viral load? She might not have a high viral load. So the lower the viral load, the better it is. If I have HIV and my viral load is undetectable, chances are I'm not going to be able to transmit the virus. Same thing with Hep C. If my viral load is undetectable, or if it's really low, chances are I'm not going to pass on the virus. So there's a lot of stigma around women that are pregnant, that have these diseases, and we want to reduce the stigma as much as we can and not think about, what are they doing? Let's think about how to prevent the spread. Now, the incubation period for Hep C is kind of a varied thing. It could be 14 to 180 days, depending on who you ask. So, that's like an approximate. I would just think about, your behavior or the activity that the person may have engaged in. If in the last 3 to 6 months, the person hasn't, really been engaged in any risky behavior, for Hep C, there may be some behaviors they were, involved in that could put them at risk for something else. But a lot of it depends on how much of the virus they were exposed to, how much of the source, how much blood were they exposed to. It's a lot of circumstances. And environment has a lot to do with it too. So if there's blood on the table, if someone says, how long does bacteria live in a kitchen? Well, how hot is the kitchen? How cold is the kitchen? How often, there's a lot of different things that contribute to the answer of that. So you're not going to get a really straight answer on how long Hep C lives outside the body, because it's a lot of different answers. So I'm not even going to give you one, but just it's very circumstantial and it's different for everybody. Sometimes if you've come in contact with Hep C, your body might fight it and you'll have no incubation period because there is no exposure. So in the incubation is more along your first contact with the virus than the first signs. So again, talk to your doctor about it, talk to a liver specialist, because the answer could vary depending on who you ask. Again, with who should be screened, If you've ever shared straws or snorted cocaine or heroin or whatever you're snorting, what happens is the drugs are abrasive and can cause the mucous membranes in your noses to get wet. And that's why people like will, you know, they'll sniff. I provide sound effects. They sniff and their runny nose, there could be blood in that. And if you stick a straw or something in your nose that you're sharing, it could get wet and come in contact with that blood, and you could pass that on that way. Having tattoos or body piercings, not everybody with tattoos is at risk for hepatitis C, same as body piercings. It's a matter of how you got your tattoos, where you got your tattoos, what were the circumstances. The same with body piercings. Tattoos have been around for hundreds and hundreds of years, thousands of years, you know, and, you know, it's really hard to get into, you know, well, how come they didn't have Hep C back then? And they have, it depends on the circumstances on, you know, where you have it done. So a lot of people that are in the military that go overseas, they come home, they have beautiful tattoos. I mean, are we going to tell them, oh, you shouldn't do that? Well, circumstances are different everywhere. So it's a real personal thing. Sexually transmitted diseases or multiple sex partners. Hep C is very, very low on the sexual transmission, but it can happen if there's blood. It has to be blood from the two people having sex. How does that happen? Well, maybe if the person is using sex toys and they share the toys without using condoms or cleaning them, and there could be blood on, and it could happen that way. Multiple sex partners, if someone has STDs and or multiple sex partners, their risks increase. So, you know, depending on what's happening and who it's happening with, it's all very, you know, circumstantial. And like I said, having sex with someone with Hep C, it's low risk. It has to be blood. Sometimes it's more risky for oral, anal, or oral vaginal sex to pass on hepatitis C and other bacteria. But again, there has to be two pools of blood. Sharing personal care items such as razors, toothbrushes, you know, nail clippers. If you're doing anything like that and you have Hep C and you use one of these things and maybe you've cut yourself or something, you don't want anybody to use it because the virus can actually be transmitted, especially like shaving. Like a lot of people, a lot of guys, you know, you shave, you might cut your neck or your chin, and say, you know, you throw the razor down and maybe your brother or somebody else might use it. That could put somebody at risk. So you just, you know, want to make sure that nobody uses your personal care items, toothbrushes especially. Things like floss, you know, floss is in a container and usually, you know, it's not reusable. So that's not something people need to be too concerned about, but definitely toothbrushes and razors. So in order to get a Hep C diagnosis, you have to first have an antibody test. The antibody test is very similar to the HIV test. It could be a finger stick, and it indicates if the body has been exposed to any antibodies. So if you have the antibodies, then you've been exposed. It doesn't mean you have a diagnosis. It means that you could be Hep C positive, but what happens is the viral load, which in the HIV terms we call the confirmatory test, has to be conducted to figure out how much active virus is in your body. So if you test positive today, okay, you test positive, but then we're going to do a blood draw. That blood draw is going to be tested, and when it comes back, we'll find out what your viral load is. Now, your viral load will indicate, okay, yes, you do have active virus, or if the viral load is undetectable, it means your body may have fought off whatever you were exposed. So if you do in fact have a confirmed diagnosis, there is a viral load, what happens is that the viral load, we can determine what your genotype is. Now the Hep C genotype is what type of Hep C do you have? Genotype 1, 1A, 2, 3, or 4. So there are the 4 most common genotypes, and that's going to determine what happens next. Are you a candidate for treatment? Do you need treatment now, or can you wait? There is that discussion that happens. Most of the discussion is, you have Hep C, let's get you treated so you can get cured. The dried blood spot test isn't available everywhere yet, especially in New York. They are doing some trials. They are the state is talking about it a lot. I would suggest that people reach out to the State Department of Health, to get more detailed information around accuracy and effectiveness and cost. There's a lot of things that are involved with it. So it's not something that everybody is using right now. It's not a very new thing, but it's still being considered, and there's a lot of positive talk around it. And that's the best answer I can give you on the dried blood spot test. Guidelines haven't really been introduced to a lot of testing sites yet around it. So that limits the amount of information, but I'm glad you asked that question. So treatment options for people with chronic Hep C, are considered after multiple tests are done. If the person has hepatitis C, how are they at risk? What's their chance of developing cirrhosis? How advanced is their liver disease? Has the person developed liver cancer? So they do a couple of these tests and screens before they go to the next step. And then once they've done some of these tests and say, okay, your liver's in a really great spot, this is a great time to treat you. Now we're going to determine what your genotype is. And the other thing is, what are your pre-existing conditions? Pre-existing condition could be HIV positive, it could be diabetes, it could be depression, migraines, anxiety, anything that we bring to the table with us, chronic cough, it really could be anything that may impact treatment. And also prior treatment history. Some people that have been treated more than once for hepatitis C are called treatment experienced. If this is your first time being treated for hepatitis, then you'd be considered treatment naive. So genotype, any pre-existing conditions, and have you been treated before will determine what's the appropriate course of treatment for you, determined between your doctor and you. You are part of the conversation. Your doctor may have a suggestion, but if you have other complications or concerns like HIV or anything, you really want to make sure you're part of the informed consent and you have a say in what treatment is best for you. For a while, some Hep C drugs weren't getting along with a lot of HIV medications. So there was a discussion, what do we treat? How do we treat it? So, you have to have that conversation, and you have to make sure you know everything you need to know to make that decision. And if you still don't know, keep asking the questions until you do. If you're not have any availability to treatment, and it might be an insurance issue, it could be, and maybe you've been on all the drugs that are out there and nothing has worked, you may qualify for a clinical trial. The clinical trials are very well observed. There's a team that are involved in these clinical trials, and they're usually for a specific period of time, and they're very well managed. So it's not like you're being a lab animal. Please don't look at clinical trials that way. Everything that we've taken for any type of illness has gone through a clinical trial. So the goal of successful treatment, of course, is to have a sustained virological response, which is also, a word that we're using for cure. So the SVR means the virus can no longer be detected 3 months after medication has been completed. Okay, so before I read the rest of that sentence, if you're on a 12-week period, we know some medications are 8 weeks. If you're on medication for 12 weeks, on that last day of that 12th week, hopefully you're having a conversation with your treating provider, and they're going to say, okay, right now we have no trace of the virus, no virological response, you're pretty much undetectable, but your treatment is over. But in 3 months, you're going to have to come back, because we want to test you off after you've completed treatment, because that's where a person can relapse. The medicine might just not work. That could be part of the relapse, or we could become reinfected. So, but during that conversation, the conversation should be, okay, you're finished with your treatment. When you go home, I want you to throw away your toothbrush, your nail clippers, your fingernail files. If you shave your head, shave anything, get rid of it all, buy all new. Because if you use anything with your old blood that's infected with the virus, now you could be reinfected if you cut yourself or if you reuse some of that equipment. So you want to get rid of all that old stuff and start anew. And that way, in that 3 months of first 3 months after treatment, you're not at any risk. And of course, if you don't inject drugs or get unsanitized tattoos, if you just minimize or eliminate your risk factors, when that 3 months is over and you go back, then that's where you'll get your final diagnosis of whether you've been cured or not. So it's actually a 6-month window rather than just the 3 months. So it's 3 months on treatment, 3 months off. Please be mindful of that. A lot of stuff happens to a lot of people when they finish a course of medicine. So just like with Hep C, these drugs are really potent. So, you just want to make sure that you do the right thing. So the cure rate based on the genotype and liver damage varies. So if you have genotype 1, the cure rate is between 85 to 99%. Now, that is huge, because if you think about the interferon and ribavirin, the old standard of treatment, the chemo-like, and the horrendous side effects, and just that cure rate or success rate was maybe 45 to 65%. Here it's doubled, and genotype 1 is not always the easiest genotype to treat. Genotypes 2 and 3, the success rate goes up even higher, 95 to 99. And of course, if you have genotype 4, your success rate is up to 100%. And this is first round of treatment. This isn't necessarily somebody that has gone through multiple treatments, because if you've gone through multiple treatments, you might need a cocktail. You might need a combination therapy of Hep C drugs because of the limited amount of medications out there. If you've used mostly everything and they haven't worked, then they may have to create a cocktail and figure it out. And Adam's question about what's the most common genotype, I'd say 1 and 1A. A lot of people, when they see these commercials on TV for certain drugs, be mindful that those drugs are only for a particular genotype classes. So some of these drugs that we see, oh, I want that. Then I go to the doctor and I find out my genotype isn't part of what that drug will treat. So the commercials don't always tell us that, but just so you know, now there are drugs out there that treat all genotypes, so nobody is left out. I think in some African American communities, depending on where the testing is done and how it's reported, genotype 1 and 1A could be higher, and maybe it might even be 2 or 3. It really depends on how it's reported. So the health department reports surveillance. So the surveillance comes from where the testing is being done and how it's being reported. So in certain communities, like in New York and Harlem and the Bronx, if those areas there's a lot of screening and a lot of reports are being done, then we're going to find out that in Harlem and the Bronx, the genotype that might be more prevalent is this, based on what we've gotten reported. So genotype 1 is the most predominant with around 91%. So, but also look at your local health departments and then look at the state. I would go through your city health department first, because they have more specific surveillance and data, where the state, it's larger, so it might not always match. So go to your city. Anything over 2 years old, I probably wouldn't invest too much into. So data sometimes comes out 2 years later, which is okay, but 3 years, 4 years, 5 years, you may want to question a little bit. That's a great question. Thank you for asking. So as we wrap up, I just wanted to let people know that a lot of times people that are getting screened, they may have to go through like liver biopsies. I remember in 1999, 2001, 2003, liver biopsy was the gold standard. Everybody that got diagnosed with Hep C had to have a biopsy. And then after that, every 5 years, it was recommended that a patient with Hep C got a biopsy. It's not a comfortable thing. It's usually something that would prevent people from going on treatment, because nobody wanted to be stabbed with this huge needle. But fortunately, things have changed, and more advanced tools have come out to determine the damage and the disease state of the liver, such as the FibroScan. This is you know, it's like another screening. There's ultrasound, there's MRI, there's a lot of different things. The FibroScan, you know, is like a really brief, non-invasive process where, you know, you go into the outpatient, you lay on the doctor's table, they put some jelly on you, and they take this and they press that button and they put it between your ribs, and it sends these magnetic waves into your liver, and it sounds like a pen is clicking, like click, 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 click. And what that's doing is it's sending vibrations to your liver, and then those vibrations, when they bounce back, it's being read and interpreted, and how quickly they bounce back determines that, you know, your liver's probably a lot better. The slower means your liver's probably a little thicker, it's probably inflamed. So it might be, and then as that's happening in real time, a score is being developed right there on the screen that your doctor can interpret and explain to you. So these are really like quick, safe, and very effective, but it's very costly. The machines are expensive, so not all hospitals can afford them. And also there might be a copay attached. So most doctors that are serving the Hep C population understand that insurance might be an issue. So a lot of folks that are using this are doing it at no cost because they care about the patient and they want to make sure the patient's liver is in good shape and can handle treatment. So, so this is, you know, something to ask about. Sometimes a doctor might disagree. He might say a sonogram is good enough, or but not too many are going to force you into having a liver biopsy. But, you know, it's important to have some type of a test done to make sure that, you know, there isn't any other damage or anything that's being missed. So that's about it. A last question came in. Is there a variation between genotypes by race and ethnicity? Well, it's kind of hard to say yes or no based on data. It depends if we're looking at the areas that are reporting screening. If we see a higher incidence rate in Hispanic men in the Bronx, hypothetically, than we see in Caucasian men in Chelsea, well, that's two different neighborhoods. It's two different groups of population. So is it a race issue, is ethnicity, or is it a geographic? And what else is it factor? So sometimes a lot of other things have to come into place. If there is one community that has a higher incidence rate of anything, well, why? You know, we want to figure out why. So it's hard to say, you know, a clear answer on why it's this way. It just a lot depends on the data and how it's been reported. And let me see. Another question, will most untreated hepatitis B or C infection open the door to cancer? Well, it could. It very well could, especially hepatitis C. If somebody has hepatitis C and they developed liver cancer, they can be cured of their hepatitis C, but not cured of the cancer. The cancer will slow down a little bit while the patient is on treatment, but it's not going to stop it or reverse it. So and if the cancer spreads throughout the body, then that's a whole nother issue. But any liver disease that's left untreated could definitely go from cirrhosis to cancer. If somebody has NAFLD, non-alcoholic fatty liver disease, and that's left untreated, that can then lead to NASH, non-alcoholic steatosis hepatitis. I'm not sure if I said that correctly, but that is an advanced stage of liver disease that develops into a cancer that could also be fatal. So any liver disease that's left untreated, undiagnosed, obviously could open the door to more advanced stages of disease such as cancer or failure.
Well, thank you very much, Paul, for always giving us support. Let's see if there's any other question before we close the webinar today. Somebody asked if we're going to share the slideshow. Actually, if I did the thing right, I have recorded this webinar and I'm going to publish it on the website and on Facebook, and also will share by email to those who attended the PDF version of the slideshow. If anybody has any more questions before we say goodbye. Well, before we say goodbye, I also want to remind you we are going to have Second webinar on May 2nd, in conjunction with hepview.org, they are going to present how hepatitis C is affecting the USA by states and cities and areas of the country. So anyway, thank you very much for joining us today. Thank you, Paul, for your support, your help in giving us this information.
Thank you, everybody, for your questions.
This is Luis Mares from the Latino Commission ACE, and thank you very much, everybody. Goodbye.
Bye-bye. Baton Rouge.